Nancy is a 48-year-old female with right medial knee pain that she's had for the past year with no known mechanism of injury. 3 weeks ago, she slipped on ice, which made her knee pain worse. She's a first grade teacher, and her main pain complaints are when she stands from the ground or a low chair, or when she ascends and descends steps. Pain is 7 out of 10 at worst, and is alleviated quickly. She says she has had to decrease her exercise routine by decreasing her walking speed and time because of pain. She's got no pain at night. When she was first seen in the clinic, she was seated with her right knee slightly extended. When she stood up, she had to use her arms and left leg mostly to stand up. When she was walking, she had decreased knee extension and stance time on the right. She's got a positive past medical history for 2 C-sections and tonsillectomy. Hip internal, external rotation, as well as flexion were full and equal and painless bilaterally. Negative Faber, Fader, and Scour test bilaterally. She was tender at her knee joint line, no palpable swelling or bony enlargement. Her passive range of motion on her left was 5 degrees of hyperextension and 120 degrees of flexion. On her right, it was negative 2 degrees of extension and 115 degrees of flexion with pain with overpressure on both. She had negative varus valgus, Lockman's loaded posterior sag test, as well as negative Ottawa knee rules. She had patellar mobility and dorsiflexion within normal limits, as well as pain-free and bilaterally. When she squatted, she made it to 50 degrees before she had pain and shifted weight over to her left side. Ascending and descending in 8-inch steps, she had pain and could not control descending. Manual muscle testing, she had 5 out of 5 quads and hamstrings, 4 minus out of 5 side lying hip abduction and prone hip extension with knee bent. Her LAPS score was 40 out of 80. She has a goal of full day of work with no pain, walking for 45 minutes, 5 days a week for exercise, meds, as a multivitamin, allergies, medication, and a leave. My assessment is I think she has acute on chronic degenerative meniscal tear. She's a good candidate for PT, and I think we should start with a range of motion exercise. That one.